Okay guys, now we're going to talk about the digestive system. Not a lot of test questions here. I'm going to point out a few basic things. The first thing I want you to do is just draw your attention here to the notes. Bottom of the page, it talks about the GI system. Second bullet point is initially voluntary, and then it becomes autonomic, parasympathetic and sympathetic. Remind yourself the function of the parasympathetic nervous system, okay? Because that's going to stimulate digestion, right? So if you make an arrow to your left or right on your notes, and write this mnemonic for parasympathetic. It's SLUD, S-L-U-D, salivation, lacrimation, urination, defecation, okay? So when you think about parasympathetic nerve supply, you want to think it does SLUD. It also does rest and digest. There it is. You've heard that phrase before, rest and digest, right? So also incorporate rest and digest and SLUD, because sometimes on standardized tests like this, it's asking you questions to see if you really understand the difference between what a sympathetic system does and what parasympathetic does. You might also remember that parasympathetic causes bronchoconstriction, right, of the lungs, and also constriction of the eyes. Whatever it does to the eyes, it does to the lungs. Constriction of the lungs, constriction of the eyes, okay? Now, I want to point your attention to this visual because there's 4 layers of the GI tract. You guys might remember that. And there's the mucosa, submucosa, muscularis externa, and adventitia, okay? So if you look at the mucosa here in this diagram, you'll see that it's the one that interacts with stuff going through the digestive system. So it's the first line of which particles will be touching, okay? Now, if you look at submucosa, it says here contains the Meissner's plexus, okay? And this is going to innervate the glands that release HCl, okay? That's going to be parasympathetic secretion again, okay? So make sure you have Meissner's, those S's, think submucosa, okay? Meissner's submucosa. Next one is going to be muscularis externa. You can see here there's 2 layers, muscle layers, an inner circular and outer longitudinal, and in between those muscle layers is Auerbach's plexus, okay? Do you guys remember if you have a problem with Auerbach's plexus, you can get a disease, right? And that's called Hirschsprung's disease. It hasn't really been hammered on old tests, but I'd pay attention to that and just kind of hone in on that. The adventitia is the least likely to get asked. The big thing I would focus on again is Meissner's plexus in the submucosa. That's probably your most likely test question in that group. So looking at Meissner's plexus a little bit more, you'll see that in bold in your notes, the term Meissner's plexus. You'll see it begins, pay attention to this, on the inferior portion of the esophagus. To be honest, I would have missed that as a student. Just kind of pay attention to that. And now as we get into the stomach, this is some good stuff. It's consistently getting hit on old tests, okay? We want to go down to the different cells. There are 6 main cell types there, and literally they've asked questions on every one of these 6. If I had to label the top 2 that's most likely to get asked, it's going to be parietal cells and chief cells, okay? So look at parietal cells. It says they do 2 things, secrete HCl and intrinsic factor. Now take a look at this visual with me for a second, okay? You're going to see here again parietal cells. There it secretes HCl, also does intrinsic factor. You guys know that intrinsic factor is going to be used to absorb vitamin B12, right? And you guys remember the disease that attacks parietal cells. It's going to be pernicious anemia, yes. So if you destroy parietal cells, you screw up intrinsic factor, which means you don't get absorption of vitamin B12. So pay attention to that in your notes. I would also know that G cells, as it says here, secrete gastrin, and that's what stimulates parietal cells in the first place. So when you look at this visual, it all starts with G cells stimulating parietal cells to secrete the HCl and intrinsic factor, okay? So kind of get that down in your head, that visual. That'll really help you get some of those picky questions right on the test. Now, as we get into small intestine, everybody, the key function of the small intestine is going to be absorption, but it also does a little bit of digestion. You guys know microvilli. Everybody see that in your notes? 3 regions, duodenum, jejunum, ileum. These have not been hugely hit items in the past. Duodenum, though, is where they like to focus the test questions. So I would skim this, take a look at it. Hey, by the way, before you do that, what is at the core of microvilli? Do you remember? Microfilaments fill microvilli. Yes, good, okay? So that's kind of the key thing to know there. If you look at the summary of digestion down there, take a look at those bullet points. The key location for most of this is going to be the duodenum, but just kind of pause and skim that for a moment. All right, guys, let's talk about the large intestine now. And if I just had to ask you, can you mention one thing you can think of that the large intestine does before we dig into the notes? Did you have lubricate the feces? Isn't that a fun one to remember? If you did, great. That's one huge thing. The other one is water absorption. Okay, so you're going to have lots of goblet cells here. That's big. And if you look at the third bullet point, no villi or microvilli here. Okay, that's a key thing you want to pay attention to. Nothing else on that's really been hit hard. That's the key points on the large intestine. Let's go down to the liver. This is something you want to star the holy heck out of. We're going to end with a bang here in this lecture. Okay, you want to know the liver well, especially its functions. But a couple of histological points we want to hit. First bullet point. It is the largest gland in the body. If you look at the second bullet point, the midline under the diaphragm, divided into right and left lobes by the falciform ligament right there in your notes, okay? That's some of the key basic points. But really where you want to spend your time is going to be looking at blood flow and looking at the portal triad. So you remember the portal triad is 3 parts: hepatic artery, portal vein, bile duct. When you think of hepatic artery, say heart artery. Hepatic artery is the heart artery. It's going to bring oxygen from the heart down to the liver. The portal vein, say, transports. Portal vein transports nutrients from the GI tract to the liver. So these are the ways we bring oxygen and nutrients to the liver, is through the hepatic artery and portal vein, respectively. All right, last but not least is the bile duct. You guys probably remember that bile is made in the liver, but it's stored right in the gallbladder. Does that ring a bell? Okay, good. So the key thing I want to look at now is getting into the functions of the liver. Okay, that's a big deal. So as you get into that, there's a heading that says the liver absorbs blood through the sinusoids for several functions. Okay, and right above that, by the way, you see Kupffer cells. You might remember Kupffer cells. As soon as you see that, you're thinking what? Antigen presenting cell of the liver. Boom. If I say microglial, what are you thinking? Right? Antigen presenting cell of the brain. If I say Langerhans cell, you're saying antigen presenting cell of the skin, right? Good. Okay, those are the key things we want to make sure we have and we know really well. Okay, so let's look at these functions. The third bullet point, detoxification of blood, it talks about how it makes urea. Bam, that's one you want to pay attention to. Makes urea. Most people think urea is made in the kidneys. That's been on an old test. You want to know that the liver makes urea. You also want to pay attention to the next bullet point, which is the most important by far, regulation of blood glucose levels, right? So remember, the liver is in charge of your blood glucose, right? So that's going to be something you're going to see, like glycogenolysis and gluconeogenesis, all that fun stuff you can't wait to see in biochem. That's reviewed in that subject, but pay attention to that. The next one is produces bile. The liver does that, right? It says right there it's produced in the liver, stored in the gallbladder, right? So those are some of the key points. If you go down to protein synthesis, you probably remember me saying earlier that albumin, right, is made here. Also complement proteins are made here, okay? Honing on that, we said albumin is going to be less, right, in patients who are malnourished. That's a key point you want to pay attention to. As we get into pancreas, guys, next, you can see there's endocrine pancreas and exocrine pancreas. You might remember that, right? Remember that the exocrine pancreas, as it says here, makes up almost all of it. That's the digestive enzymes, whereas the endocrine pancreas that gets all the notoriety because of the islets of Langerhans, right, and the alpha cells, beta cells, that's going to be a small portion of it. So as we look in our notes here, look what it says underneath endocrine. It says small endocrine component dispersed throughout the organ as islets of Langerhans, right, which synthesizes insulin. What portion, right? What cells? Bensulin, right? Beta cells do that. What about glucagon? It's glucagone, right? So it's going to be alpha cells, right? We got it. All right. Another question we get right, guys. You just keep pounding through this section. Last but not least, exocrine pancreas. It says right here, first bullet point, serous secretory acini, right? They're going to secrete proenzymes. So what I would do is look at these dashes of proenzymes, right? You see trypsinogen, pepsinogen. Pay attention to that, right? Because that's something they could easily ask a question or two just wanting you to know, do you remember which proenzymes are secreted, right? Which ones are they? And be able to locate that those are from the exocrine pancreas. So pause on that. I wouldn't spend a lot of time on it, but make sure you point your attention to it. All right, guys, the last thing that's important, and then we're done, all right? Hey, by the way, turn the page for a second. Look what you see there. You see the reference page, everybody's favorite page, right? So we're almost done. We're that close, all right? So what I want to point out to you for a minute is underneath endocrine pancreas, you guys see alpha cells secrete glucagon, beta cells, insulin. You're all over that. And you can see there delta does somatostatin. What I want to pay attention to now for a second, I'm going to give this to you quickly. Whenever you see glucagon, I want you to think loves the sympathetic nervous system. Whenever you see insulin, I want you to think is all about parasympathetic system. We'll talk about that more in biochem, but the key thing you want to know is when we have glucose in our bloodstream, either the glucose is going to get into cells or it's going to stay in the blood. If it goes into cells, guess who wants that? Insulin. Insulin wants to put glucose, it wants to store it inside of cells, whereas glucagon wants to keep the glucose in the bloodstream, okay? And when you see that on the test, if you're confused or you're trying to correlate what does glucagon want or what does insulin want, if the question kind of gets down to that bottom line for you having to put it on a team, that's how you do it. Glucagon wants the glucose in the bloodstream so it can be used by the sympathetic nervous system, fight or flight, right? Whereas parasympathetic, all about rest and digest, wants to store it and wants to be able to store it through the use of insulin, okay? So that's how you want to think through that. Guys, this section that we just covered, really, really important because it bled into multiple other areas. I hope you found the review really, really helpful. I'm super excited to have this section done for you guys. Just keep marching along. It's going to be well worth it. And keep this overall focus every time you're going through this of how you can help your patients. Sometimes studying for a test like this, I remember it well myself, it can be like a drag and you're just like, oh, I got to get through another section. Keep thinking about being an unbelievable doctor because that's really what it's about. It's not about a test. It's about being an unbelievable doctor that happens to crush this test. So stay with it, keep working, guys.